When taking ascorbic acid, it's important to follow the instructions carefully. You can take it with or without food, usually 1 to 2 times a day. If you're using the extended-release capsules, make sure to swallow them whole with a full glass of water. If you're using wafers, chewable tablets, or lozenges, follow the specific instructions for each type. If you're using the powder or liquid form, be sure to measure the dose accurately and take it as directed. The dosage will depend on your medical condition and how you respond to the treatment. It's important to take ascorbic acid regularly to get the most benefit from it, so try to take it at the same time each day. And as always, if you think you may have a serious medical problem, seek medical help right away. If you experience diarrhea, nausea, vomiting, abdominal cramps/pain, or heartburn, it's important to let your doctor or pharmacist know. However, many people using ascorbic acid do not have serious side effects. If you notice painful or pink/bloody urine, it's important to notify your doctor right away. While a serious allergic reaction to this medication is rare, it's crucial to seek medical help immediately if you experience symptoms such as rash, itching/swelling, severe dizziness, or trouble breathing. If you notice any other effects not mentioned here, make sure to contact your doctor or pharmacist. Before taking ascorbic acid, it's important to speak with your doctor or pharmacist about any allergies you may have. This product may contain inactive ingredients that can cause allergic reactions. It's also important to discuss your medical history, especially if you have kidney disease or a certain enzyme deficiency. If you are pregnant or breastfeeding, it's important to talk to your doctor about the recommended doses and any potential risks or benefits. If you are planning to have surgery, make sure to inform your doctor or dentist about all the medications and products you are using. As always, it's best to consult with a healthcare professional for more information about taking ascorbic acid. When taking ascorbic acid, it's important to be aware of potential drug interactions that may affect how your medications work or increase your risk for serious side effects. It's best to keep a list of all the products you use, including prescription/non-prescription drugs and herbal products, and share it with your doctor and pharmacist. Before making any changes to your medication dosage, it's crucial to seek approval from your doctor. Additionally, it's important to note that ascorbic acid may interfere with certain lab tests, such as certain urine glucose tests, which could potentially lead to false test results. It's imperative to inform lab personnel and your doctors about your use of this vitamin to ensure accurate test results. If you believe someone has taken too much ascorbic acid and is experiencing severe symptoms like loss of consciousness or difficulty breathing, it is important to seek medical help immediately. In the U.S., you can call the local Poison Control Center at 1-800-222-1222, and in Canada, you can contact a provincial poison control center. It's important to keep all your medical and lab appointments, especially when taking ascorbic acid. Remember, this product is not a substitute for a proper diet. It's best to get your vitamins from healthy foods. Ascorbic acid can be found in citrus fruits like oranges, tomatoes, Brussels sprouts, cauliflower, and broccoli. If you want to know more details, it's best to consult your doctor, pharmacist, or nutritionist. And as for the daily dosage and optimal timing, it's all about what's best for you, so make sure to ask your healthcare provider for guidance. If you forget to take a dose of ascorbic acid, take it as soon as you remember. If it's almost time for your next dose, just skip the missed one. Take your next dose at the regular time. Don't take a double dose to make up for the missed one. When it comes to storing ascorbic acid, it's important to follow the instructions on the product package or ask your pharmacist for guidance. Always keep medications out of reach of children and pets. And make sure you dispose of any expired or unused product properly. You can consult with your pharmacist or local waste disposal company for the best way to do this. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.